Diabetes mellitus is a group of metabolic diseases characterized by chronic hyperglycemia, high blood sugar, resulting from defects in insulin secretion, insulin action, or both. This condition can lead to various acute and chronic complications that significantly impact overall health. The two primary forms of diabetes are type 1 diabetes, T1D, an autoimmune disorder where the immune system attacks insulin-producing beta cells in the pancreas, leading to little or no insulin production. It usually manifests in childhood or adolescence, but can occur at any age. Type 2 diabetes, T2D, more common and typically associated with insulin resistance, where the body's cells do not respond effectively to insulin. This form is often linked to obesity, physical inactivity, and genetics, and is more prevalent in adults, but increasingly seen in children and adolescents due to rising obesity rates. Physical impairments. Cardiovascular complications. Diabetes is a major risk factor for cardiovascular diseases, CVD, including coronary artery disease, stroke, and peripheral artery disease. The mechanisms underlying these complications include atherosclerosis. Chronic hyperglycemia contributes to endothelial dysfunction, promoting the formation of plaques in the arterial walls. This condition narrows blood vessels, reducing blood flow and increasing the risk of heart attacks and strokes. Hypertension. Diabetes often coexists with hypertension, creating a vicious cycle that further damages blood vessels and increases cardiovascular risk. Elevated blood pressure can also exacerbate kidney disease, leading to additional complications. Heart failure. Diabetic cardiomyopathy, a condition that occurs independent of other heart disease factors, can lead to heart failure due to structural and functional abnormalities in the heart muscle. Neuropathy. Diabetic neuropathy refers to nerve damage caused by diabetes and can affect various nerve types, leading to significant complications. Peripheral neuropathy affects the extremities, leading to symptoms such as tingling, numbness, burning sensations, and pain. Patients may experience difficulty in walking due to loss of proprioception, awareness of body position, increasing the risk of falls and injuries. Autonomic neuropathy impacts involuntary functions, resulting in issues such as gastroparesis. Impaired stomach emptying can lead to nausea, vomiting, and erratic blood glucose levels due to delayed digestion. Bladder dysfunction. Neuropathy can cause overactive bladder, urinary retention, or incontinence. Cardiovascular dysregulation. Autonomic dysfunction can result in postural hypotension, a drop in blood pressure when standing, which may cause dizziness or fainting. Vision impairments. Diabetes poses a significant threat to eye health, leading to several vision-threatening conditions. Diabetic retinopathy. Damage to the retinal blood vessels can cause leakage of fluid and blood into the retina, leading to vision loss. It progresses through stages from non-proliferative early to proliferative advanced, where new, fragile blood vessels form and can bleed. Cataracts. Diabetic patients have a higher risk of developing cataracts, which cloud the lens of the eye, leading to blurry vision and difficulty seeing at night. Glaucoma. Increased intraocular pressure, a risk factor for glaucoma, is more common in individuals with diabetes, potentially leading to optic nerve damage and vision loss. Kidney damage. Diabetic nephropathy is a severe complication of long-term diabetes, characterized by glomerulosclerosis. The glomeruli, which filter blood in the kidneys, become scarred and lose their filtering capacity. Over time, this can progress to chronic kidney disease, CKD, and end-stage renal disease, ESRD, necessitating dialysis or kidney transplantation. Proteinuria. The presence of excess protein in urine is an early sign of kidney damage, indicating that the kidneys are not functioning properly. Skin conditions. Individuals with diabetes are more prone to skin problems due to poor circulation, neuropathy, and weakened immune response. Diabetic dermopathy, characterized by light brown, scaly patches on the skin, often on the shins. These patches are usually harmless, but can indicate underlying vascular issues. Infections. Diabetics are at a higher risk for bacterial and fungal infections, particularly on the skin and in moist areas, e.g., between toes, underarms. Infections can become severe due to impaired healing and reduced immune function. Diabetic foot ulcers, resulting from neuropathy and poor blood flow. These ulcers can become infected and may lead to serious complications, including amputations. Poor wound healing. Elevated glucose levels impair the body's ability to heal wounds effectively. The healing process requires adequate blood flow, immune response, and cellular function, all of which can be compromised in diabetics. Delayed healing. Minor injuries may take longer to heal, increasing the risk of infections and complications. Foot complications. The combination of neuropathy and poor circulation can lead to serious foot problems, emphasizing the need for regular foot care and monitoring. Organic impairments. Endocrine system dysfunction. Diabetes disrupts the normal functioning of the endocrine system, particularly insulin and glucagon regulation. Insulin resistance. In T2D, the body cells become resistant to insulin, leading to increased insulin production by the pancreas. Over time, this can exhaust pancreatic beta cells, leading to insufficient insulin levels. Hormonal imbalances. Besides insulin, diabetes can affect the secretion and action of other hormones, such as glucagon, cortisol, and growth hormone, leading to further metabolic complications. Digestive system impairments. Diabetes can result in various gastrointestinal issues, complicating management of the disease. Gastroparesis. Damage to the vagus nerve can slow gastric emptying, causing symptoms like bloating, nausea, and erratic blood sugar levels due to unpredictable digestion. Diarrhea or constipation. Autonomic neuropathy may disrupt the normal functioning of the digestive system, leading to irregular bowel movements. These changes can impact nutrient absorption and overall health. Increased risk of celiac disease. Diabetics, particularly those with T1D, have a higher prevalence of celiac disease, which can further complicate dietary management. Musculoskeletal issues. Long-term diabetes can affect bone and joint health, resulting in various musculoskeletal problems. Charcot foot. This condition involves progressive degeneration of the foot's bones and joints due to neuropathy, leading to deformity and increasing the risk of ulceration. Osteoporosis. Diabetes, especially T1D, is associated with decreased bone density, increasing the risk of fractures and osteoporosis. Limited joint mobility. A condition known as diabetic chiroarthropathy can cause thickening of the skin on the hands and limited joint mobility, impacting daily activities. Reproductive health. Diabetes can have profound effects on reproductive health for both men and women. Erectile dysfunction. Men with diabetes often experience erectile dysfunction due to nerve damage and impaired blood flow, which can significantly affect quality of life and self-esteem. Female sexual dysfunction. Women with diabetes may face decreased libido, difficulties with arousal, and complications related to pregnancy. Diabetes can also lead to menstrual irregularities. Pregnancy complications. Women with pre-existing diabetes face increased risks of complications such as gestational diabetes, preeclampsia, and congenital anomalies in the fetus. Mental health issues. The chronic nature of diabetes management can take a toll on mental health, depression, and anxiety. Individuals with diabetes are at a higher risk for depression and anxiety disorders. The constant need for monitoring blood sugar, dietary restrictions, and the fear of complications can contribute to psychological distress. Cognitive impairment. Research suggests a link between diabetes and cognitive decline, potentially due to vascular damage, metabolic factors, and increased inflammation. This can lead to difficulties with memory, attention, and problem-solving. Diabetes distress. This refers to the emotional burden of living with diabetes, encompassing feelings of frustration, fear, and burnout related to self-management. The impairments caused by diabetes are extensive and multifaceted, affecting nearly every organ system in the body. The chronic nature of the disease necessitates rigorous management and monitoring to prevent complications. Understanding these impairments is crucial for developing effective prevention strategies and treatment plans. Early intervention, such as lifestyle modifications, diet and exercise, proper medication management, and regular medical checkups, is essential for preventing or delaying the onset of complications. The integration of healthcare providers, including endocrinologists, dietitians, and mental health professionals, can significantly enhance the quality of life for individuals with diabetes. Overall, while diabetes poses serious health challenges, comprehensive care and education can empower individuals to manage their condition effectively, reduce the risk of complications, and lead fulfilling lives. Diabetes mellitus has emerged as a significant global health challenge, affecting millions of people worldwide. According to the International Diabetes Federation (IDF), as of 2021, approximately 537 million adults aged 20 to 79 years are living with diabetes, a figure expected to rise to 783 million by 2045. This alarming trend underscores the need for effective management strategies to mitigate the complications associated with this chronic disease. Diabetes can be classified into two primary types: type 1 diabetes, T1D, characterized by autoimmune destruction of pancreatic beta cells, leading to insulin deficiency, and type 2 diabetes, T2D, which is marked by insulin resistance and relative insulin deficiency. T2D accounts for approximately 90 to 95% of all diabetes cases globally, primarily driven by factors such as obesity, sedentary lifestyles, and unhealthy dietary patterns. The rise in prevalence of diabetes is alarming, with estimates suggesting that by 2030, diabetes will be the seventh leading cause of death worldwide. The long-term complications of diabetes are significant, affecting various organ systems and resulting in increased morbidity and mortality. Common complications include cardiovascular disease, neuropathy, nephropathy, and retinopathy. Furthermore, the economic burden associated with diabetes management is substantial, with the IDF estimating that global health expenditures on diabetes will exceed $966 billion by 2021. Despite advancements in diabetes care, including pharmacotherapy and lifestyle interventions, a considerable proportion of patients struggle to achieve optimal glycemic control. Consequently, there is growing interest in complementary and alternative medicine approaches, particularly the use of medicinal herbs. Traditional herbal remedies have been utilized for centuries in various cultures to manage diabetes and related glycemic issues. This text aims to explore 5 medicinal herbs with potential benefits in the treatment of diabetes, discussing their phytotherapeutic properties, clinical indications, contraindications, forms of use, recommended dosages, and precautions. Through this exploration, we will shed light on the scientific evidence supporting the use of these herbs and their role in contemporary diabetes management. Medicinal herbs for diabetes management. Gymnema sylvestre phytotherapeutic properties. Gymnema sylvestre, also known as sugar destroyer, is a climbing plant native to India and Africa. Its leaves contain gymnemic acids, which are believed to reduce sugar absorption in the intestines and enhance insulin secretion from the pancreas. Studies have shown that Gymnema sylvestre can significantly lower blood sugar levels and improve overall glycemic control. In one clinical study, participants who consumed Gymnema sylvestre extract experienced a significant reduction in fasting blood glucose levels and HbA1c, indicating improved long-term glucose control. Clinical indications. Gymnema sylvestre is primarily indicated for the management of type 2 diabetes. Research indicates that it may help lower blood sugar levels, reduce the craving for sugar, and support overall glycemic control. Clinical trials have demonstrated its efficacy in improving HbA1c levels in individuals with diabetes, making it a valuable adjunct to conventional diabetes treatments. In particular, a systematic review of randomized controlled trials found that Gymnema sylvestre supplementation led to significant improvements in glycemic parameters in diabetic patients. Contraindications. Individuals with hypoglycemia or those on insulin therapy should exercise caution when using Gymnema, as it may potentiate the effects of these medications, potentially leading to dangerously low blood sugar levels. Additionally, individuals with known allergies to plants in the Apocynaceae family should avoid its use. Forms of use. Gymnema sylvestre is available in various forms, including capsules, tablets, and teas. The tea can be made by steeping dried leaves in hot water, while capsules and tablets provide a more concentrated dose of the active compounds. The dried leaves can also be powdered and used in cooking or as a supplement. Dosage. The recommended dosage ranges from 200 to 400 milligrams of standardized extract per day, divided into 2 or 3 doses. It is important to start with a lower dose and gradually increase it based on individual tolerance and response. Some studies have used doses as high as 600 milligrams per day without adverse effects. Precautions. Patients should monitor their blood sugar levels closely when taking Gymnema, especially if they are on anti-diabetic medications. It is also advisable to consult a healthcare professional before starting any new supplement to avoid potential interactions with other medications or treatments. Berberis vulgaris barberry. Phytotherapeutic properties. Berberis vulgaris is a shrub that contains berberine, an alkaloid known for its glucose-lowering effects. Berberine has been shown to improve insulin sensitivity and decrease hepatic glucose production, making it a potent agent for managing blood sugar levels. In addition to its glycemic benefits, berberine has demonstrated anti-inflammatory and antioxidant properties, contributing to its overall therapeutic effects. Clinical indications. Berberis vulgaris is indicated for type 2 diabetes management and has demonstrated efficacy in lowering fasting blood glucose and HbA1c levels in clinical trials. Research has shown that berberine can effectively reduce blood sugar levels comparable to some conventional diabetes medications, such as metformin. A meta-analysis of randomized controlled trials indicated that berberine supplementation significantly improved fasting blood glucose and lipid profiles in patients with type 2 diabetes. Contraindications. Pregnant and breastfeeding women should avoid berberine due to its potential to cross the placenta and affect fetal development. Additionally, individuals with liver disease should consult a healthcare professional before use, as berberine is metabolized by the liver and may exacerbate liver conditions. Forms of use. The herb can be consumed as a tincture, capsule, or tea. The tincture is typically taken in small doses and is a concentrated form of the active compounds. Capsules provide a more standardized dose, while teas can be made by steeping dried barberry in hot water. Dosage. A typical dosage is 500 milligrams of berberine extract, taken 2 to 3 times per day. It is important to follow the dosing recommendations on the product label or as directed by a healthcare provider, as higher doses may be needed in some cases for optimal results. Precautions. Berberine may interact with various medications, including those metabolized by the liver, necessitating careful monitoring and consultation with healthcare professionals. It is advisable to start with a lower dose to assess tolerance and gradually increase it if needed. Cinnamon, Cinnamomum verum. Phytotherapeutic properties. Cinnamon has been recognized for its potential to enhance insulin sensitivity and lower blood sugar levels. Its active compounds, such as cinnamaldehyde and polyphenol, are thought to mimic insulin's action and improve glucose metabolism. Several studies have indicated that cinnamon can lower fasting blood glucose and improve lipid profiles in individuals with diabetes. For example, a randomized controlled trial found that cinnamon supplementation led to significant reductions in fasting blood glucose and HbA1c levels over 40 days. Clinical indications. Cinnamon is commonly used as a complementary treatment for type 2 diabetes, with several studies reporting reductions in fasting blood glucose and improvements in insulin sensitivity. Some meta-analyses have suggested that regular cinnamon consumption can lead to significant improvements in glycemic control, making it a valuable addition to diabetes management strategies. Contraindications. Individuals with liver disease or those taking anticoagulants should use cinnamon with caution due to its potential effects on liver enzymes and blood clotting. It is advisable to consult a healthcare professional before using cinnamon supplements, especially for those on anticoagulant therapy. Forms of use. Cinnamon can be consumed as a spice in food, in tea, or in supplement form, capsules, or extracts. Ground cinnamon can be added to oatmeal, smoothies, or baked goods for added flavor and health benefits. The essential oil of cinnamon can also be used in aromatherapy, although it should not be ingested without proper guidance. Dosage. The effective dosage of cinnamon extract ranges from 120 to 600 milligrams per day. It is important to choose high-quality cinnamon supplements to ensure efficacy and safety. Ground cinnamon can be added to foods in varying amounts based on taste preferences. Precautions. High doses of cinnamon may cause gastrointestinal discomfort, and it is advisable to start with lower doses to assess tolerance. Individuals should also be aware of the potential for cinnamon to interact with other medications, particularly those affecting blood sugar levels. Fenugreek, Trigonella phenumgricum, phytotherapeutic properties. Fenugreek seeds are rich in soluble fiber and have been shown to lower blood sugar levels by slowing down the absorption of carbohydrates in the intestines. The seeds contain several bioactive compounds that enhance insulin sensitivity and promote healthy glucose metabolism. Clinical studies have shown that fenugreek supplementation can lead to significant reductions in fasting blood glucose and HbA1c levels in patients with diabetes. Clinical indications. Fenugreek is indicated for both type 1 and type 2 diabetes and has been associated with reduced fasting blood glucose and HbA1c levels in clinical studies. Some research indicates that fenugreek may also help reduce cholesterol levels and improve overall cardiovascular health in diabetic patients. A systematic review of clinical trials suggested that fenugreek supplementation consistently improved glycemic control and may provide additional cardiovascular benefits. Contraindications. Pregnant women should avoid fenugreek, as it may stimulate uterine contractions. Individuals with allergies to legumes should also exercise caution when using fenugreek. It may also exacerbate hypoglycemia in those already at risk. Forms of use. Fenugreek can be consumed as whole seeds, powder, or in supplement form, capsules, or extracts. The seeds can be soaked in water overnight and consumed in the morning or ground into a powder and added to various dishes for flavor and health benefits. Dosage. A typical dosage is 5 to 30 grams of fenugreek seeds per day, or 500 to 1,000 milligrams of fenugreek extract taken 2 to 3 times daily. It is advisable to consult a healthcare professional to determine the appropriate dosage based on individual needs. Precautions. Patients should monitor their blood sugar levels closely while using fenugreek, particularly if they are on anti-diabetic medications. It is also advisable to consult with a healthcare provider to ensure safety and avoid potential interactions with other medications. Bitter melon, Momordica charantia, phytotherapeutic properties. Bitter melon is known for its blood sugar-lowering effects, attributed to its active compounds, such as charantin, polypeptide-p, and vicine. These compounds have been shown to enhance glucose uptake and improve insulin sensitivity. Clinical trials have demonstrated that bitter melon can effectively reduce fasting blood glucose and HbA1c levels in individuals with diabetes. Clinical indications. Bitter melon is primarily indicated for type 2 diabetes and has been extensively studied for its hypoglycemic effects. A systematic review of randomized controlled trials found that bitter melon supplementation significantly improved fasting blood glucose levels, HbA1c, and overall glycemic control in diabetic patients. Contraindications. Individuals with hypoglycemia should use bitter melon with caution, as it may lower blood sugar levels further. Pregnant women should avoid bitter melon, as it may lead to uterine contractions. Additionally, individuals taking anti-diabetic medications should consult a healthcare professional before using bitter melon due to potential interactions. Forms of use. Bitter melon can be consumed in various forms, including fresh fruit, juice, or supplements, capsules, and extracts. The fresh fruit can be juiced or cooked and added to dishes. The bitter melon extract is available in concentrated forms, which may provide a more potent effect. Dosage. A typical dosage for bitter melon ranges from 1,000 to 2,000 mg of extract per day, taken in divided doses. For fresh fruit, consuming about 100 to 200 grams daily is common. It is advisable to start with a lower dose to assess tolerance before increasing the amount. Precautions. Patients using bitter melon should closely monitor their blood sugar levels, especially if they are on anti-diabetic medications. Consultation with a healthcare professional is essential to ensure safe use and to avoid potential interactions. The increasing prevalence of diabetes worldwide highlights the urgent need for effective management strategies to control blood sugar levels and prevent complications. As conventional treatment approaches may not be sufficient for all patients, the integration of medicinal herbs offers a promising avenue for enhancing glycemic control. Herbs such as Gymnema sylvestre, Berberis vulgaris, cinnamon, fenugreek, and bitter melon have demonstrated significant potential in lowering blood sugar levels and improving insulin sensitivity. While these herbs can provide valuable support in diabetes management, it is crucial for individuals to consult healthcare professionals before incorporating them into their treatment plans. This is particularly important for patients on existing medications, as herbal remedies may interact with pharmaceuticals and lead to unforeseen complications. By merging traditional herbal medicine with modern therapeutic approaches, individuals with diabetes can potentially achieve better health outcomes and improved quality of life. Future research into the mechanisms and efficacy of these medicinal herbs will be essential to solidifying their role in contemporary diabetes management. As the understanding of herbal remedies continues to evolve, they may become an integral part of a holistic approach to diabetes care, empowering patients to take charge of their health while minimizing the risk of complications associated with this chronic disease.